One Toronto woman left suffering Pfizer vaccine side effects, proves how her injury claim was mishandled by Toronto Public Health, whose conflicting reports to her and her family doctor left her injury unrecognized and dismissed as psychological. In today's report, I'm going to share with you their evasive, cloaked in privacy concern response and detail what health authorities were saying at the time of this vaccine injury. Stay tuned. A few days ago, I featured a report on a Toronto woman named Annabelle Edge, who has been grappling with the severe aftermath of a COVID-19 vaccine injury. Well, Edge says that she experienced a manageable reaction to her first novel vaccine dose from Pfizer. She faced complications following her second shot, leading to an increase in pain and pre-existing neuralgia, excessively swollen lymph nodes in her neck, and facial paralysis, known as Bell's palsy. Edge's attempts to document her injury through the adverse events following immunization, that's the AEFI system, were thwarted by Toronto Public Health's mishandling and misleading communications to her family doctor by issuing two versions of her injury report, one version to her and another modified version to her family doctor. This mishandling has resulted in a prolonged struggle for Edge, and her condition gaslit as being psychological, with Toronto Public Health hinting at a diagnosis of functional neurological disorder called FND.
I think that if you had an AFI, never mind if it's Toronto Public Health or any public health, I think you should call your doctor's office and confirm, is it the same letter?
This was only in the letter that was sent to her physician, not to Edge. And they stated that this is, and I quote, often triggered by a combination of abnormal physical and psychological experiences, something they expect to develop in some individuals after vaccination due to a combination of heightened stress owing to the pandemic, feelings of uncertainty about the vaccine, and the normal transient physical symptoms and discomfort after vaccination, end quote.
The letter that we have on file, we have two.
Oh.
So what I see here that had done, and I do apologize for the confusion because I would understand as a client, I wouldn't understand it either. So there's one that she had sent over to your family physician, Dr.
Mm-hmm.
And then there's one that she had sent to you. The one that she had sent to Dr. has an additional paragraph and a bit of a sentence. Let me just.
It actually has two additional paragraphs.
So I have here while there's no safety signals for COVID-19. You have both, correct?
Well, I just found out on June 21st that the letter my doctor received is not the same as the copy that was sent to me by Toronto Public Health.
Then what nurses were doing is they were sending out additional information based on the consult that the physicians had sent on our end. So they wrote another explanation for her symptoms. They didn't want to provide the client that just because that might provide confusion. The intention behind the letter was the physician would go run it over with you, kind of explain what the letter means. I do understand the frustration because you were told that it's the same letter.
Yeah.
I know, and I'm so sorry just for the miscommunication on our end, and she's no longer with the organization.
Yeah.
But I could see the frustration. It was just more so the way that I believe that we would see it is the recommendation doesn't change. However, it's the blurb explaining that you're missing in your letter. It's not as clear as it should have been.
It wasn't until Edge finally received a referral to a specialist that she was advocating for nearly 2 years that she discovered the wording of Toronto Public Health, leading to her continued disregard. Finally, Toronto Public Health issued Edge a third letter in August 2023, acknowledging her condition, but this letter did not make it up the bureaucratic chain of vaccine injury command and into the federally administered vaccine injury support program known as VISP, of which Edge was awaiting an approval. She says this gross oversight led to the dismissal of her VISP claim, leaving her back at square one, struggling with an injury, only able to function for short periods of time without needing substantial rest in between, suffering in severe pain without expensive out-of-pocket treatments, and ultimately unable to care for herself, work, or care for her 2 teenage sons. I reached out to Toronto Public Health for comment, and they didn't answer any of my questions directly, citing privacy concerns, even though I intentionally did not mention any names, identifiable features, or specific injuries. I simply asked, when did Toronto Public Health become aware that vaccine-injured individuals and their family doctors are receiving documentation discrepancies from the AEFI investigator? Yes, such a thing exists. How was this handled by Toronto Public Health? Specifically, was an investigation launched into the AEFI investigator/process responsible for this? What is TPH's role in the flow of AEFI reports to PHAC and or VISP? How many individuals have been impacted by this discrepancy, and has it been corrected? If so, how? Someone named Keisha for Toronto Public Health Media Relations responded that Toronto Public Health takes all reports of adverse events following immunization very seriously, including any concerns raised about documentation discrepancies. We are committed to ensuring that all reports are handled with the utmost integrity and transparency. To protect personal health information, Toronto Public Health cannot comment on individual cases. No one asked them to. Individuals who think they are experiencing an AEFI are advised to contact their healthcare provider and let them know you feel unwell and recently received a vaccine. Anyone can report an AEFI to Toronto Public Health. Healthcare providers are required to report AEFIs to Toronto Public Health. Toronto Public Health reports AEFIs to the Ontario Ministry of Health, Public Health Ontario, and the Public Health Agency of Canada to make sure that vaccines are as safe as possible, even after they are approved. Companies that produce vaccines do not help with investigations of AEFIs, but they are aware of reports for the safety of their products. Now, all of Edge's struggles are compounded by the fact that Pfizer's own clinical trial data, which was released through court order back in March 2022, highlight instances of neuralgia, excessively swollen lymph nodes called lymphadenopathy, and Bell's palsy. This was after the fact that by April 2021, the science had already been finding and keeping an eye on an increase in facial paralysis, again known as Bell's palsy, following the novel injections based on the World Health Organization's pharmacovigilance database that monitors international drug adverse events. These instances happened primarily in women of Edge's age range. By August 2021, Health Canada acknowledged the risk in an advisory update that advised industry professionals to be alert of the signs and symptoms of side effects following vaccination with COVID-19 vaccines, and to report any event potentially related to the vaccine to your local public health unit. So after all of this, it seems that following the science might just mean following a never-ending maze of miscommunication and red tape. Edge's experience with Toronto Public Health's mishandling of her vaccine injury case highlights a frustrating truth. Bureaucratic blunders can turn a legitimate medical claim into a nightmare.
It made a huge barrier. And that's the number one reason why I'm doing this interview, is because I'm not the only person that this was being done to. I'm not, I know that for Toronto Public Health. I don't know if other public health agencies were doing this, but this idea of sending one letter to the patient and allegedly the exact same copy to the doctor is just ridiculously dangerous.
While Toronto Public Health's response was to hide behind privacy concerns, the real issue is their failure to correct these discrepancies or even acknowledge how widespread this problem just may be. For Rebel News, I'm Tamara Ugolini. You can stay up to date on this report and others at nomoreshots.ca. That's our special website dedicated to the reporting on the novel COVID-19 injections, where we also call on Federal Minister of Health Mark Holland to revoke market authorization for these injections. You can find out more, support our work, sign our petition, and send a form email to Minister Holland at nomoreshots.ca.